To receive the very first Forbes Health Equity Award, please welcome Ann Jenkins, Chief Executive Officer, AARP, and presenter Moira Forbes, Executive Vice President, Forbes, President and Publisher, Forbes Women.
Hi, I have the very special privilege today of presenting the inaugural Forbes Health Equity Award. Ann Jenkins is a dynamic change agent and a passionate leader who is relentless in her commitment to empowering others. She's built an extraordinary career around public service and championing opportunities for people at every stage of their life. She also exemplifies a really inspiring American success story. Ann grew up in Mobile County, Alabama, and as the youngest of four siblings, she was raised by parents who instilled in her the importance and value of education. After graduating from Alabama's Spring Hill College, she began her career working in the federal government, first at the U.S. Department of Housing and Urban Development, followed by time at the Department of Transportation and the Department of Agriculture. In the early 90s, she worked within the Library of Congress, eventually becoming COO. Since joining AARP in 2010 and heading it since 2014, Ann has transformed the organization into a true leader in social change, dedicated to empowering people to choose how they live and age. And ultimately in this work, she's redefined AARP's vision with relevant solutions to everyday issues such as health, financial resilience, digital and social connectivity, work opportunities, and personal fulfillment. Across these efforts, Ann has been a remarkable trailblazer for her work against discrimination and her work to ensure equitable access to healthcare, particularly for the most vulnerable. Ann, thank you so much for joining us today. We are so thrilled, as I said, to honor you with this inaugural award. So thank you.
Thank you. It's a pleasure to be here with you.
Work in the community that you do at AARP really serves as an intersection of so many of the challenges, but also the opportunities for real change. Talk a little bit about the ways in which you all are looking to reframe the conversation and identify solutions to solve for the challenges given the complexity of the stakeholders within the ecosystem, but also given how critical it is in nature with the community that you serve.
Well, thank you, Maura. And I think what's been so interesting, particularly in 2020, not only with COVID-19, but also with the racial unrest and really such a divided country. We've seen particularly our members, but not just them, it's also their families, really want to focus more in their community. And so AARP, which is a national nonprofit, really has moved aggressively to being in communities in all 50 states and communities around the country to really be where our members live and breathe and really concerned about the issues that concern them in their everyday lives. And certainly this past year with COVID-19, we have all had to transform and reimagine and really it has brought to the forefront the kind of crisis of health inequities and also financial inequities and just how vulnerable our social safety net in this country is. I know we at AARP have been working these issues for many, many years, but you saw when we all went home to work the middle of March, who would have ever imagined that we would still be home in November and that we would continue to see these racial inequities jumping up all over the country. And so we're looking at these two crises at the same time. What we've tried to do at AARP is to be that trusted voice and that fierce defender, particularly for those who are most vulnerable, particularly for minorities and the underserved. And we've seen that play out so dramatically with respect to health inequalities in minority communities and in rural America. And I hope that your viewers and our members feel like they can depend on AARP to be there in their community, not just in Washington, D.C., where the major national legislation is happening, but in local communities, working with mayors and governors and local elected officials and other nonprofits to try to get them access to food and health and all of the things that they need during these very difficult times.
When we're talking about urgent needs and challenges that need to be addressed, How do you think stakeholders within the healthcare system need to be thinking differently about the community that AARP serves and what society should be doing to better support this population within this unique moment in time? How do we think differently and galvanize specific action items?
Well, as you said, people over the age of 50 have been disproportionately affected by COVID-19, and particularly families of African-American descent and Hispanic even more so. And so we have been working directly with a lot of the governors around the country, particularly as with respect to nursing homes and facilities. We worked aggressively trying to define those 4 or 5 things that every individual who is in a nursing home needs to have access to, starting with transparency. We've seen on the news, how difficult it is when you have a loved one in a nursing facility and you can't get in to see them. And we know that those nursing homes are cutting off visitation for protection, but it still doesn't make it easier. And we've talked about and advocated for PPE equipment so that those frontline workers have access to PPE equipment. And then also that there is a way to communicate. I think one of the things that we've all awakened to is the use of telecommunications and Zoom and Microsoft Teams and all those other virtual kind of technologies. But we want to make sure that nursing home facilities have that available so that people can stay connected to their loved ones, even if in fact they can't go in and visit. And we have to move forward. We have to think about, how do we help communities, whether it's local mayors or governmental agencies or other nonprofits and communities, try to deliver quality services to those most in need through this difficult time. And that includes quality access to healthcare. One of the things that we're most proud of is really trying to make sure that Medicare would cover the cost of telemedicine visits. And for years, we've been trying to develop that strategy to get our members to be more attuned to and more open to telemedicine. Who would have known that COVID-19 would allow that transformation to take place really over a matter of 6 to 8 months? And we see a willingness on behalf of our members and older people to be able to use these kind of technologies, but we have to make sure that's available. And so we need to make sure that we're working with the technology community as well as some of these facilities to make sure that everyone has access to the technology itself and that we make it as convenient as possible for people to really try to get on their feet and have some good quality health care, as well as having the financial means to be able to support themselves in this difficult time.
As I said when we began, we're at this incredible inflection point in this country and around the world. You've been someone who has been a really dynamic change agent across your career, thinking through your life, the different roles that you've served in the public and private sector. Talk about how your advice in terms of taking this moment on. How have you previously, and how do you think about today in terms of really turning this crisis into an opportunity to not just create a new normal, but a better normal?
Mm-hmm. Well, I think back on my career, and I've always had the opportunity to work in positions that was really making life better, whether that was in the housing area, whether it was in transportation, or even when I worked at the Department of Agriculture, when I was over the small and minority businesses, as well as economic opportunities. It really is about how do we give back and put good policy and guidance in place that helps the majority of people in this country do that. I think one of my favorite stories that I like to tell is when I worked for Elizabeth Dole when she was Secretary of Transportation, and we really put in place what we called a 10-point program to elevate women in the federal workforce, particularly in the transportation industry. And I say that because so much of this is about the opportunity. How do we reach back and give others the opportunity and the experience, whether it's through a job opportunity or serving on a task force or having that kind of exposure, or mentoring, or what I like to call sponsoring, particularly young women or women of color and other minorities, to have the opportunity to be put in a position to excel in what it is that they do. And I think when I think about us at AARP, we've had what we call courageous conversations, particularly coming off of the many murders that has occurred with African-American men and women in this country. And we launched this courageous conversations inside AARP to say, let's have some frank conversations. We've always been, as an organization, at the forefront of these kind of conversations externally, but let's talk about how we feel internally. As AARP is going out advocating for whether it's around Social Security or access to safe and affordable health care, how do we make sure that we include that disparities work in the work that we would normally do, to make sure that we're reaching back and looking to make sure that everyone has access to it and that it's not just a select few. And I think that's been, the theme of my career is to really look back and make sure that we're not leaving anyone behind. And so as we think about what a new social safety net might mean for here in the U.S., we also see organizations like the World Economic Forum actually taking on that task as well, because COVID-19 just didn't hit us in the U.S. And there aren't just racial inequalities here in the U.S. It really is worldwide. And I'm glad that AARP is playing a small part of that conversation.
Well, thank you for those insights, Joanne, and again, for your work to continue to be on the front lines of progress. All of us have benefited from the work that you've done across your career and obviously your leadership at AARP. So on behalf of everyone at Forbes, again, we're so thrilled to honor you with the inaugural Forbes Health Equity Award. You are someone who truly exemplifies the spirit of this recognition, and we are so thrilled and privileged to share it with you this year.
Well, great. Well, thank you, Moira. I am deeply honored to be recognized with Forbes' inaugural Health Equity Award, and I'm proudly accept this award on behalf of all my colleagues at AARP who work hard every day to break down those barriers to build equity across the lifespan. AARP has always fought to build a more equitable America and to advocate for programs that empower all people to live and age with dignity and purpose. And we know that discrimination of any kind corrodes our communities and our society from inside and out, and it frays our democracy. And as we consider this moment in time, it's clear that this work is more important than ever. What Dr. Martin Luther King said so many years ago still rings true today. He said, "We now are faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This has no time for apathy or complacency. This is a time for vigorous and positive action. The pandemic has given us the time and the space to think about who we are, what's important, and what kind of country we want to be. And this is an opportunity for a new beginning, and business and nonprofit organizations like AARP and all of our citizen employees have a role to play in shaping what this new beginning should look like. And it begins with each of us doing our part to enhance the public good. The late Congresswoman Barbara Jordan once said, "What people want is very simple. They want an America as good as its promise." We are fortunate to have a unique system of government that enables us to speak freely and advocate for change. And these freedoms are the soul of our democracy. We have to work together to create a society where all people have access to the financial resources and the opportunities to match our longer lifespans. And we have to work together to create a society where all people are seen as an integral and inspirational asset to society. If there's one thing I would like to see come out of this global pandemic, it would be that we take advantage of the opportunity we have now to build an equitable world society. So let us unite to create a society that values hope over hate, faith over fear, and compassion over confrontation. Let us all unite as one and commit to creating a country where every person has the opportunity to live a life of dignity, in good health, economic opportunity, and purpose, regardless of our race, income, or age. So let us dedicate ourselves to unite behind our common values and to create a sense of decency and respect for one another. When we do that, we will create an America as good as its promise. So thank you so much for this award, and I'm honored to accept it on behalf of all of us at AARP.
Thank you, Joanne, for those inspiring remarks. Again, it's a privilege to honor you and the AARP community this year. And we look forward to the work that you and all the constituents within the AARP community are doing in the months and years ahead to fulfill on that promise that you so beautifully outlined. Thank you so much, Joanne.
Thank you. It's great to see you.